Thomas, good to see you. We are talking Medicare open enrollment and planning for healthcare in retirement. In retirement, your biggest expense is almost always healthcare. And open enrollment, I want everybody to get their pens and calendars out. It is coming up October 15th through December 7th. And I want everybody to be aware of those dates because you can be penalized, right? So, Thomas, do you have any guidance for somebody who now qualifies for Medicare?
Yeah, absolutely. I think that one of the most important things that you can do is actually get with a licensed Medicare rep. They're going to help you look at the different options that are available and kind of analyze what you currently have right now, and be able to expedite the process if you're going through getting signed up. Because, like I said, like you just stated, that deadline will come pretty quick.
Mm-hmm. And a question that you said that you receive from people often is, what if I qualify for Medicare and my spouse doesn't, or vice versa?
Yeah, so that's a good question to speak to a medical rep on. But typically, it's an individual plan. So once you hit 65 as an individual, you're able to qualify for that. Sometimes there are situations where one may be older than the other. That person either has to think about once you do qualify, if you're on a plan from work, maybe you want to think about covering out for that other person, or maybe they want to looking at potentially looking at some private insurance, or they if they're 62 and they paid for 10 years of coverage of Medicare, they can possibly even pay the premiums on the
Mm,
Medicare. Typically,
okay.
when you're 65, you don't have to pay for the premiums for Medicare A. Obviously, you're
Mhm.
going to for the Medicare insurance part, which is Part B. So,
Okay. All
mhm.
right. Now, as we mentioned, you qualify for Medicare at 65, but let's say I'm part of the Great Resignation and I want to retire early at 60. What do I do for those 5 gap years?
Yeah. So, same thing. You're going to either possibly look at Medicare, or excuse me, not Medicare, but look at private insurance. You're also going to possibly look at covering out of your current job if you decide to retire. And some people, if you're age 62, you can start looking at paying those premiums as well on the Medicare A until you're age 65.
Mhm. Also, it's kind of open enrollment for people picking their health plans. And so that often includes a high deductible plan, which would include access to an HSA, a health savings account. That's
Mhm.
something that you recommend people consider.
Absolutely, I think that is a great way, to earmark some money in regards to if you have some health situations in the future. Then, and if you're at a job, that can also be deductible for you as well. So sometimes those things even roll over. So definitely a great option for you to look at to kind of supplement your Medicare costs.
All right. Well, this was really helpful. Thomas, if somebody has questions, what's the best way to reach you?
Yeah, you can check out my website, info at Martin Heritage Group LLC.com. You can also shoot me an email at info at Martin Heritage Group LLC.com. Give me a call, 651-503-6064. And then you can reach me on all social media platforms, typically at Martin Heritage Group. Or you can get with me this way. I've been bubbling my words all day. Apologies.
All the ways. We know you're there. All right, Thomas, that was perfect. Thank you.
Thank you.